Picture something. It's early. The house is still mostly asleep. The light through the kitchen window is that soft gray it gets before the sun really commits. You're 68 years old, and you reach for the coffee pot the way you've reached for it 10,000 mornings before. Except this morning, your fingers don't quite cooperate. They feel stiff. A little swollen, maybe. It takes them a minute to wake up, the way it has, if you're honest, for a while now. And you do what almost everyone does. You shake them out. You tell yourself it's just getting older, and you pour the coffee. I want to talk to you about that minute. Those few quiet minutes between the time you wake and the time your hands finally feel like yours again. Because here's the truth that most doctors never get to say in a 15-minute appointment. That stiffness in the first hour of your morning isn't always age. Sometimes it's the earliest, quietest signal of something your body started fighting months ago. And the window to act on it, right now, is wide open. My name is Dr. Evan Jace, and on this channel I do one thing. I sit down with you, the way I'd sit down with you at my own kitchen table, and I translate what your body is actually telling you into plain language you can do something with by tomorrow morning. No fear. No fine print you need a medical degree to read. Just the things I wish I had time to explain to every patient who ever sat across from me and said, "It's probably nothing, doc." So, let me be very precise here. There is a condition called rheumatoid arthritis, and it whispers in the hands long before it ever shouts in the joints. And the earliest whispers, almost every single time, show up in the morning. In that first hour. In that exact window where catching it changes everything. Today, I'm going to walk you through 5 morning signs in your hands worth taking seriously. One of them surprises almost everyone. And one of them is the sign people most often wave away. The one I see missed again and again. Before we get into them, do me a favor. Tell me in the comments where you're watching from this morning. Your town, your state. I like to know who I'm talking to. It reminds me these aren't lectures, they're conversations. Now, before the 5 signs, I need to give you one idea, one lens. Because if you understand this single thing, the rest of it clicks into place and stays with you. Here's what most people don't realize. Rheumatoid arthritis is not the same animal as the arthritis most of us expect. The common kind, osteoarthritis, is wear and tear. It's the cartilage in your joints slowly wearing down after 70 years of good hard use. That's the stiffness that shows up after you use your hands, late in the day, after gardening, after a long drive. It aches when you've worked it. Rheumatoid arthritis is something else entirely. It's not wear and tear. It's your own immune system, the same system that fights off a cold, getting its signals crossed, and mistakenly attacking the soft lining inside your joints. It treats your own knuckles like an intruder. And here is the cruel little detail in the timing. This kind of stiffness is worst in the morning, after rest. Not after you use your hands, after you don't. Overnight, while you're still, the inflammation pools and settles. So osteoarthritis hurts after you use it. Rheumatoid arthritis hurts before you've used it at all. That single difference, after versus before, is one of the most useful things you can carry out of this video. And now the part that matters most. When this immune attack begins, it begins quietly, and it usually begins symmetrically, the same joints on both hands, like a mirror. And in those early months, the inflammation is active, but the cartilage and bone underneath are still intact, still whole, still yours. Rheumatologists call this the window of opportunity. It's the stretch of time when the disease is making noise but hasn't yet done permanent damage, and when the right treatment can actually halt it before it carves anything into the joint for good. That's the whole game. There's a difference between damage you can still prevent and damage you can only manage afterward. And those first 60 minutes of your morning are very often where that line gets drawn. So hold on to that picture, the open window, because we're going to come back to it at every single sign. The first sign is the one we already started with. Morning stiffness that lasts longer than an hour before your hands loosen up. Now, everybody's hands feel a little creaky when they first get up. That's normal. The difference, and this is the line I want you to remember, is the clock. Osteoarthritis stiffness tends to ease within a few minutes of moving around. The inflammatory kind hangs on. 30 minutes? 45? An hour or more before your hands feel like they belong to you again. I think of a woman named Carol, 66, from a little town outside Toledo, Ohio. She told me she'd started getting up earlier, not because she wanted to, but because she'd learned that if she got up an hour before her husband, her hands would be ready by the time she had to make breakfast. She had quietly rearranged her whole morning around this stiffness, and she'd never once thought to mention it to a doctor, because in her mind, it wasn't a symptom, it was just her. That's the thing about this sign. It's so easy to absorb into your routine that you stop seeing it. So here's what to do about it, and it's simple. Start timing it. Honestly, from the moment your feet hit the floor to the moment your hands feel normal. If that number is consistently over an hour on most mornings, that's worth a conversation. Type it in the comments if you want. How long does your morning stiffness last? You'll be surprised how many people are about to type the same number you are. The second sign is symmetry. Swelling in the same knuckles on both hands at the same time. This is the one people most often dismiss, and I understand why. If your right hand bothers you, you think you slept on it, or you overdid it, or you tweaked it somehow. We always reach for the mechanical explanation. But the immune system doesn't play favorites. When it's behind the swelling, it tends to hit both hands in a mirror pattern, the same middle knuckles, the same base of the finger joints, left and right together. Mechanical injuries are usually one-sided. This symmetry is one of the clearest fingerprints that what you're dealing with is inflammatory, not an injury. I remember a man, Frank, 71, from Macon, Georgia, a retired carpenter, hands like worn leather, who'd broken and jammed every finger he owned over the years. He was the last person to think a little knuckle swelling meant anything. But what finally got his attention was that it was the exact same two knuckles on both hands. It's like they're matching, he told me. And that word, matching, is exactly the thing rheumatologists and early arthritis clinics are trained to look for. So here's what to do. Look at your hands in good light. Compare them. Are the same joints puffy on both sides? That mirror is information worth bringing in. The third sign is one you can't always see, but you can feel. It's a tenderness, a soft, boggy, sponge-like feeling when you press gently across your knuckles. Healthy knuckles feel firm and bony when you squeeze across them. When that joint lining is inflamed, it swells with fluid, and the feel changes. It goes from firm to spongy. There's a give to it that shouldn't be there, and often a tenderness that makes you wince a little. Doctors actually feel for this in an exam. We call that boggy quality a real signal of active inflammation in the joint lining. A patient named Eleanor, 74, from Spokane, Washington, described it better than any textbook. She said pressing her knuckles felt like there's a little pillow under the skin where there used to be a knob. That's it exactly. So here's the gentle self-check. Take your thumb and press softly across the row of knuckles on the back of each hand. You're not looking to hurt yourself, just to notice. Firm and bony is reassuring. Soft, spongy, tender, especially on both hands, is something to mention. The fourth sign is about function. Difficulty making a full fist, or a weakened grip, first thing in the morning. This is where the stiffness stops being just a feeling and starts stealing things from your day. When the joints are inflamed and swollen, your fingers physically can't curl down the way they should. So you go to make a fist, and there's a gap. Your fingertips won't quite reach your palm. Or you reach for that jar, the one you've opened 1,000 times, and the lid just spins because your grip isn't there yet. And here's why the morning timing matters so much. It's worst right after rest, and it eases as the day goes on. If your grip is reliably weakest in that first hour and stronger by noon, that pattern itself is the clue. I think of a woman named Ruth, 69, from Burlington, Vermont, who loved to knit for her grandchildren. She came in not because of pain, but because she'd had to put the knitting down in the mornings. Her fingers wouldn't cooperate until later in the day. She framed it as losing a hobby. What she was actually describing was a textbook early functional sign. So here's your check. Each morning, try to make a full closed fist. Can your fingertips touch your palm? Can you open the jar you always open? If the answer changes with the hour of the day, that's the kind of detail that helps a doctor enormously. And now the fifth sign, the least known one, the one that surprises almost everyone, because it isn't about your hands at all. It's the unusual morning fatigue, sometimes paired with small, soft nodules, that reminds us rheumatoid arthritis is a whole body disease, not just a joint one. This is the piece most people never connect. Because rheumatoid arthritis is driven by the immune system, by inflammation moving through your whole body, It often comes with a deep, heavy tiredness, especially in the morning. Not, "I didn't sleep well" tired. More like you slept 8 hours and woke up feeling like you ran a marathon in your sleep. People almost never link that fatigue to their hands. They blame their age, their mattress, their thyroid. But when that whole-body weariness shows up alongside stiff, swollen morning hands, the two are very often the same story. And sometimes, not always, there are small, firm, painless lumps that appear under the skin, often near the elbows or the backs of the fingers. They're called nodules, and they're another sign that this is something systemic, moving through the body, not just a local joint problem. A gentleman named Walter, 72, from Tucson, Arizona, is the one I think of here. He came in about the fatigue. Just the fatigue. He mentioned his hands almost as an afterthought, on the way out the door. But it was the two together, the bone-deep morning tiredness and the stiff, mirrored hands that told the whole story. That's why I saved this one for last. Because the sign people most often ignore is the one that ties everything together. So here's what to do. Don't file your morning fatigue in a separate drawer from your hands. If they're both happening, they belong in the same conversation. So now you have all five. And I don't want you to walk away from this worried. I want you to walk away ready. Let me give you the tool. Here is what you do. You don't have to diagnose yourself, that's not your job. And please don't try. Your job is just to notice and to report clearly. So for 1 week, keep a small note. 3 things only. How long does the morning stiffness last? Is it both hands in a mirror? And does your grip or your fist get better as the day goes on? That's it. 3 observations written down turn a vague "my hands bother me" into something a doctor can act on immediately. And then there's the phrase. The specific words that get taken seriously. When you go in, don't say, "My hands are a little stiff." Say this. "I think I should be checked for inflammatory arthritis." Those words tell your doctor exactly which door to open. They prompt the right questions, the right blood work, and if needed, a referral to a rheumatologist, ideally to an early arthritis clinic, where catching this early is the entire point. And I'm telling you, these are questions a good doctor welcomes. Asking to be checked early isn't being difficult. It's being a good partner in your own care. Because remember the window. The earlier that conversation happens, the more of that window stays open. The more of your own hands stay yours. Let me close with the thing that actually matters here. This was never really about a checklist of symptoms. It's about a line. The line between catching something while you can still change its course and finding it after the damage is already done. Between hands that stay yours, that keep buttoning your shirt, opening the jar, holding a grandchild's hand without you even thinking about it, and hands that slowly stop being able to do the things you love. Your hands are how you touch your whole life. They've done everything for you, every single day, without asking for credit. And paying attention to them now, really listening to what they tell you in that quiet first hour, that isn't worrying. I want you to hear me on that. It's not worrying. It's caring for yourself. It's protecting the independence those hands give you for as many years as you can. So listen to your body. Ask early. You're allowed to. You're allowed to walk into that office and say, "Something's changed, and I want to understand it." That's not panic. That's wisdom. If this helped you see your own mornings a little differently, do me a favor and subscribe so I can keep sitting down with you like this. And then tell me in the comments, how long does your morning stiffness last? And what's the one thing your hands do every day that you'd never want to lose? I read these, and I'll see you in the next one. Take care of those hands.